right, this is Zakia with Cozy Quilts for Scholars, and I have Chris. Please introduce yourself.
Hi, my name is Chris Martin. It's good to meet everybody, or I'm honored to be here, rather.
Dr. Chris Martin. So today, we're just going to do a quick impromptu interview. I'm using my phone. You guys know I don't know how to video. You know I don't know how to edit, so bear with us as we go through this interview today. It's very impromptu. His mom is here from Dallas, Texas. He just graduated from
The David Geffen School of Medicine at UCLA and the Charles Archer University of Medicine and Science.
in psychiatry. How about that? So, Chris, tell us a little bit about your journey and how you got where you are.
Ooh, okay.
You start way back in elementary school, like where you went and all of that.
Sure. So, in elementary school, I was at the Soto Private School. Growing up, I was raised by relatives who had a very, very strong interest in education across the board. So I remember that learning and achievement and everything. I feel like mom was really smart in that she almost gamified it for me at a very early age. I'd see her reading and deriving a lot of pleasure from knowledge seeking and stimulating her mind. So it was just something we did in the house, and school felt like an extension of a lot of that joy. So I enjoyed elementary school for the most part.
What state and city?
I'm sorry. I was in DeSoto, Texas.
Okay, very
Yeah.
good.
So yeah, DeSoto Private School was an excellent environment for me. Got out of there, did 1 year of middle school in Mansfield, Texas. I was at Wester.
Okay.
And then after that, from 8th grade through high school, I was at Bishop Dunn Catholic School in Oak Cliff.
Yeah, don't tell anybody, but Wester's not the best school in Mansfield. Shh.
Fair enough. I haven't been in a real long time. Those loyalties are they're not as strong as they used to be.
I think they've since torn it down and rebuilt it like they're doing every other school in Mansfield. They're completely gutting them to the cement and rebuilding them with that taxpayer money that I gave them. But, it did you well for that year. It did my kids well for their, education. So, yeah. Anyway, I probably shouldn't say that. Maybe I'll learn how to edit that out. But anyway.
So you can say.
Okay, so then after you finished your private school education, where did you go? Where was your first 4 years of college or first 2 years? How did that go?
Oh, right. So this kind of bleeds into a high school story, but there was I am blanking on the name. There was some sort of leadership program that they hosted for high school students at Stanford University. And I went to that, really fell in love with the campus. I was very enamored with the idea of California, and it just seemed like a place full of all this possibility. So I applied a bunch of places. Despite really wanting to go to school in California, I think Stanford was the only Cali school I applied to. High school,
Stanford is good. Maybe I have to take a trip up there and videotape that for the channel too.
Highly recommend it. It's a beautiful place. But no, I was there for all 4 years of undergrad. I was a human biology major.
Okay.
The major is really, really big. I think it encompassed, I don't know if it is now, but it was definitely a top 3 major. I feel like it was computer science, human biology, and something else at the time. But it had a lot of different subdivisions and concentrations. And so my concentration in the program was public health and underserved communities.
Okay.
I came in very, very pre-med. Did not like pre-med classes. I remember having a moment where I was in a chemistry class and we had just made a battery, and I got very frustrated and thought this has nothing to do with helping people. And so I did a lot of prereqs for pre-med stuff, but actually switched to a public health focus for the latter part of college.
Okay.
Toward the end of college, that led to an internship at the AAMC, that's the Association of American Medical Colleges.
Okay.
I thought I wanted to do public health and education work, and I still do in many regards, but I didn't realize I could integrate a lot of passions at that point. So I went there. Long story short, I actually ended up meeting a medical student and 2 really, really fantastic doctors who mentored me, let me shadow them, and I came back to Stanford as a senior and said, okay, I want to be a physician. I'm 100% in.
Okay.
So graduated from Stanford with my human biology degree, and then after that I did a post-baccalaureate program.
Mm-hmm. What is that?
Yeah, so a lot of people who go to medical school do not wake up knowing that they're going to do this.
Okay.
And so it's a career changer program, essentially.
Okay.
So post-baccalaureate just means that you have graduated college, but you still need to take these pre-med courses.
Okay.
So,
in order to get into med school.
exactly.
Okay.
Yep. So I went to the University of Virginia largely because it was cheap and it was the shortest one. A lot of these programs are 2 years. Theirs was 1 year. So I said, okay, let's just get it over
So
with.
how many units a semester, or was it a quarter system?
Ooh, my sense of those things is kind of skewed because Stanford was quarter system, Virginia was a semester system.
Okay. So it was a year, so probably 30 units maybe?
Honestly, I
don't remember. Okay.
But it was every pre-med course just done one after the other over the course of 365 days, give or take.
Okay.
So took all of those, passed all of those, completed the program, and then I had to take the MCAT.
Ooh. How was that?
It was a weird time, but it worked out. So I remember I had graduated the post-bac program, but I still had a few more weeks on my apartment there. And I remember, kind of weighing whether I wanted to go home or not. And I was like, let me just stay here and kind of make it a study retreat space. So
smart.
For 3 or 4 weeks, and I had friends in the area doing some other things. So we'd work out every day, give ourselves some break beyond the monotony and repetition that came with studying. And I just did a bunch of practice tests. There was a book series called Exam Crackers that broke things up by subject. Yeah. Yeah, but I just ran through it. I don't know a better way to study other than mind-numbing repetition and talking through things. So I just did that over and over. Test day went really, really well for me. And then I got into medical school. Okay.
And where did you go first, you said? For medical school? Or where did you go? I lost.
Yeah, no, so it's a bit unusual. So I was part of a joint program between 2 medical programs.
Okay.
So there's Charles Drew University and there's David Geffen School of Medicine at UCLA.
Right. I remember that now. But go ahead.
Every year they take, I think it's 24 of us.
Oh, wow.
They're applicants who say, I want to commit my career to underserved populations or traditionally underserved populations. And so you are a full-time student in both programs. You graduate from both programs. So technically I have an MD from both programs.
Okay, how about that? Sucky. Now you see why I wanted to interview him? Because he's good. His mama's sitting over there.
Hi, Mom. Oh, I did skip the Masters. My bad. Mom
She's
is mad
whispering.
that I skipped the Masters.
She's not mad. She's just offering a suggestion.
She's not mad. She is coaching.
There you go. There you go.
No. So, sorry. I... After the post-bac program, it takes a year to apply to med school. So, so during that year, I remember, speaking quite honestly, not knowing 100% sure if I was going to get into medical school, still having a very, very strong public health interest. And so Stanford had just started a program in community health and prevention research. So during my application year, I got a master's in science at Stanford in community health.
In a year?
Yes, ma'am.
How many units?
For that one, I've forgotten the unit number. I'm sorry.
You know why I'm making a face? Because I'm in clinical psychology, and it's a 3-year program, and I can take 1 class a semester.
I think I was usually in 4 or 5 classes a quarter.
No.
But it was...
That's good. That's excellent. I'm saying no for me. Ain't no way. But he's young.
They were gentle with me, too. It was very project-based.
And, that helps.
Yeah. Okay. So what I did there was my research focused on minority perceptions of precision health as well as physician perceptions of precision health. Precision health is a very big kind of amorphous term, especially back then. I didn't mean to tap you.
You're fine. You're fine.
But no, the idea is that some people will say precision medicine instead. Precision health was meant to be more expansive.
Elaborate a little bit on that title, precision health. What does that mean?
Sure. So the idea was to make health interventions that were as tailored and individualized as possible.
Per person or per person or per culture, per what?
All of the above. So in a perfect world, people would look at me and they would say, look at this Black American man from Texas who's 6 foot something in his 30s. What treatment is best for him? We're not there yet, but there's a lot of interest in medicine and healthcare applications more broadly specified, getting more and more specific. The problem with that is you would need to do a lot of research and get a lot of input from various populations throughout this beautiful country with a very dark history. And so part of my role was to take advantage of being in the Bay Area. So it was at Stanford where it's a fairly diverse
Okay,
base in the
that
Bay,
was my
right?
next question. Okay,
Yep,
go ahead.
so you have Black folks,
You have an
there's-
Asian high. Is there a high Asian population?
Mhm.
An Indian, as in Indians.
There were a lot of Lakota Sioux up there as well who were
Okay.
part of our research.
What's that?
It's a tribe.
Okay.
Yeah.
American Indians then.
Mhm,
Okay.
Exactly. But yeah, multiple permutations of multiple ethnic groups, a
Okay.
huge Latinx population, as you can probably imagine as well. So we had various partners in those different communities.
Okay.
We talked to them. It was a lot of focus groups saying, if a researcher wanted to collect samples of your DNA for X, Y, and Z, how comfortable would you be with that? Do you trust the medical system? Does the idea excite you or make you nervous? Basically, how comfortable would you be with leaning into this process?
Okay.
And do you think, that participating in these efforts would be a good thing for you ultimately, or are you wary of it for some reason? So a lot of my role up there, I was still taking classes, but we were very focused on just kind of completing the project. And so I started that work as a master's student. By the time we wrapped everything up and got the paper published, I was in medical school, but that's what I was doing during my master's year.
And so what was the title of the master's degree?
So it's a master's in science and community health and prevention research.
Okay. And so tell us the name of the paper that you wrote, because I want to look that up later too.
Woo! Okay, you might have to crop this part because I know it's in the Journal of Ethnicity and Medicine.
Okay.
Something about precision health and minority populations. I'm happy to
that's
email
close
you with
enough.
a link later. I'm sorry.
Okay. That's okay. That's close enough. I can put a link in the description bar if anybody's interested. That's cool. Okay, so let's move on, because I don't know how long this is going to let me videotape, to your med school part.
Yeah.
So tell me how that started and how you chose psychiatry.
Sure. So, goodness. So, when you say how that started, you mean like how was the transition into medical school, or
Wherever you want to go with it.
Okay, cool. I'll just talk and you can guide me.
Okay.
Came into medical school actually with a primary care scholarship. So primary care, just for the purposes of anyone watching, you can think of these as everybody's doctor, kind of your first stop if something is wrong.
Okay.
A family practice doc, a pediatrician, that sort of thing.
Okay.
Because that's where a lot of the need is. And I was interested in working with vulnerable populations. And, the U.S. is at an interesting time in that within the past few years, a lot more people are insured, but the number of providers hasn't gone up proportionally.
Right.
So we need primary care
Right. And I was
providers.
looking on a Facebook post, and there was a young lady saying that she wanted a black female, counselor. She didn't say psychiatrist, but she was saying she, wanted black female. And then Thursday in class, we had the lady trying to give us something interesting, gave us a piece of paper that said the young lady wanted to see a male psychiatrist, but her issue was with her father, and she blamed her father for everything that was wrong. So one of the questions we posed in our group was why she wanted to see a male psychiatrist if she felt like all men were bad. But we kind of concluded that she may have wanted to overcome that because she was like 34. It was just a scenario. She was 34, and maybe she wanted to get married and have kids and a family, blah, blah, blah. So, yeah.
Yeah, I mean, that speaks to the need for diversity among our providers as well. That was a big pull with psychiatry as well, and I'll get to that very soon. If I don't go chronologically, I'll get confused.
You're fine.
Yeah, I came in very eager on my primary care scholarship, was super confident I would do family medicine or pediatrics. One of my associate deans at UCLA at the time was a psychiatrist who was very supportive, but I remember telling her, I'm going to be a pediatrician. I didn't know this was coming at all. And
I'm out of the picture. I'll move over.
Okay.
Don't keep talking.
I'll keep going. And so I remember there's like two reasons I picked psychiatry, and we'll start with just kind of the patient care piece. So first was I went through first year, second year, third year. As you go through medical school, you transition more from a preclinical, which is more of a like classroom experience, to clinical experiences, which is a big part of what third and fourth year is about. The goal is just to get you living the life of a doctor as much as possible, figuring out what the ins and outs of the job are, etc.
Okay.
So I did my primary care rotations, and all of my favorite patients they had psych comorbidities.
Okay, so those of you that don't know, comorbidity means you have more than one Emotional. I'm just going to say emotional issue.
Exactly. So, it's a sick teenager, but they have depression.
Right.
Older man with kidney failure, but he's got PTSD, things like that.
Okay.
And I always latched on to those scenarios a little more tightly than other ones.
Okay.
And it became apparent I had an interest in it. Then my psych rotation came, my psychiatry rotation, and I loved every minute of it.
Okay.
I always end up leading focus groups, like little focus groups with patients on the inpatient unit.
Okay.
I have a passion for putting things in plain English. We had a lot of patients on the unit who they weren't comfortable taking their medicine, and I would just, very candidly be like, okay, you're on this drug. What do you think it does? If
Right.
we're not a provider and you bumped into me on the street, what would you say this is doing to you?
Right.
And they're like, well, it does something
Education.
with dopamine. And I'm like, what do we think dopamine is? And we just...
Educating the patient about their medicine and how it
Exactly.
works and the ins and outs of it. Okay.
Exactly. And
That's very much needed.
very much so, because there's a lot of misconceptions, especially in psychiatry, about what meds you're taking and what they'll do to you, how safe things are, this whole...
And unfortunately, a lot of doctors that don't want to take the few minutes that it takes to explain it to you. Because I have found in my own case, sometimes they think you're not going to understand. Well, if you explain it to me, I will.
Exactly. And, you kind of meet people where they are in terms of their
Right.
understanding. Like, there's some
Right.
people where it's like, what do you think this drug is? They have no idea. We're kind of starting from the ground up.
Mhm.
Other people have actually done quite a bit of research. They've tried things before and it didn't work for them.
Right.
Yeah, it's good to start by asking what their understanding is,
Right.
and kind of going from there. I think that part of it gets neglected because I don't know a doctor who isn't overextended, or in a really tight time crunch. But I've found it to be beneficial to make that
course.
time. But yeah, so all my favorite patients were psych patients. I keep bumping you.
You're
That's the
fine.
last time.
You're fine.
But
I don't mind.
another reason that I really thought it would suit me was because, well, I realized later when I was making my personal statement how big of a role he kind of played, because I had a mentor at Stanford. He's since passed away. His name is Dr. Larry Zara. Dude was a powerhouse cardiothoracic surgeon. Very, very brilliant. And
Okay, what's cardiothoracic?
sure. So, heart and thorax. Think about things happening in your chest.
Okay, perfect.
And he was known for being a notoriously casual, the word dude slipped out because he would insist that we call him Larry. He
Okay.
wore an Elmo hat.
Very calm.
Very casual, but he also
Casual,
was
yeah.
an old school surgeon in many ways. You could not come late to his class.
Okay.
And not in ooh, I'll be mad at you. He would be like, I closed the door. Like, why'd you come in? If you were going to be a minute late, why show up? He was that kind of
Okay.
teacher.
Prompt
exactly.
but casual.
You could tell he was used to training medical people.
Okay.
If I had a question or it was time for me to speak, he would just cold call you and you'd have to stand up. So anytime, and this was independent of how well he knew you,
Okay.
If I had a point to make or he thought I should say something, he'd be like, stand. I had to stand up and say, hi, my name is Christopher Martin. And he would just push you very hard, no matter what the subject matter was.
Okay.
But one thing that always struck me was he was very, very humanistic. So he would always say, what are we doing for the patient's soul?
Okay. That makes sense.
Very much so. And even in mentorship meetings, like he wrote a recommendation letter for me for the post-bac programs. We would talk about school and medicine. He'd be like, do this with your grades. This is what I recommend next. And he would be like, okay, enough of the boring stuff. Are you in love yet? How's your life going? You got a girlfriend, huh? She's smarter than you, isn't she? That always happens. It was just, he was very interested in, what makes life worth living, what really is driving people. And I always told myself that if I get to be a physician, I wanted to, try to speak to the parts of people's lives that were most salient to them. And I think psychiatry is the closest we get to that.
Mm-hmm. Okay. Any more that you want to add? Because I have another question, but it's totally off.
No, go ahead. I mean, I guess the last thing would be, now that I'm a practicing psychiatrist, I'm 10 months into it. I think, thank you. I really like that feeling of handing
See, now
people...
I'm touching you. I'm listening.
Feel free. I really like that feeling of handing people their functioning back. I think I've caught people in very acute and extreme scenarios, and I've also...
You want to elaborate on that because other people won't have a clue what you mean.
Oh, sure. So my training at Olive View, they especially early on, you get a lot of inpatient psychiatry exposure. So these are people who need to be committed to, when I say inpatient, I mean within a hospital.
Okay.
They cannot leave. They have to be there, usually on the order of weeks or months.
Okay.
We hope for weeks. Sometimes it's months, depending on how severe the presentation is. We also work.
How did they get admitted?
So some of this might be a little bit California specific, but let's say that actually, yeah, maybe we can walk through it this way. So let's say for whatever reason, someone becomes a danger to themselves,
Okay.
a danger to others, or gravely disabled. Somebody like me or anybody else who is certified might then place them on a hold.
Okay.
The kind of people that place people on holds, doctors, social workers.
So they might come in because a family member called?
Exactly. So,
Okay.
A typical scenario
Okay.
is, my 20-something-year-old is now behaving unusually. They're
Okay.
refusing to eat,
Okay.
We had an interaction where they got violent. They broke a painting in the house, something unusual.
Okay.
And so what usually happens is emergency responders get called, and many times the first responder will notice, okay, there may be a psychiatric component contributing to
Okay.
this. They're not quite reality-based.
Right. Okay.
So rather than go to jail, they get placed on a hold.
Gotcha.
That's the typical scenario. There's a million permutations, and we can talk about that if you want. But, if that happens, you might end up going to a emergency room. And if that happens at Olive View Medical Center where I work, you may end up in a psychiatric emergency room.
Gotcha.
We're unique in that we have a more traditional medical emergency room and one for psychiatric instances as well. But when you're there, what I would do as the doc there is accept the hold. So the first responder would write the hold, and they basically make an argument, very brief but salient, saying, hey, they're doing X, Y, Z. This is what the family is saying. These are the witnesses I have, and based on this, they need a evaluation period. So the first hold is 3 days. Well, 72 hours. Sometimes people are sticklers for saying 72 hours.
Okay.
But it's a 72-hour window where we can observe you, where we can give you medications, trial things. During that period, you still have the right to decline treatment.
Right.
If you decline treatment indefinitely, there are means for us to pursue ways to medicate you against your will. Yeah.
Okay.
But yeah, so the first hold is 72 hours. If we think you need more time, we extend it. The minute we file to extend it, you get a hearing. Just by virtue of patients' rights, they're very big on that on this side, which is a good thing.
Right.
Because we don't want to keep anybody against their will longer than is therapeutic. But at that point, we have up to 14 days to work with you.
Okay.
And then the next extension would be 30 days. And so you can imagine that as your stay becomes longer than 3 days. So a psychiatric emergency room, when it's working perfectly, is really transitioning people in a matter of hours or days, right?
Okay.
If you need a longer stay, so you go from a 3-day hold to a 14-day hold, the chances of you getting referred to an inpatient facility, so some portion of a hospital or a medical facility where they're working with patients with psychiatric illnesses in the long term, that's when you're on the inpatient unit. And so what I was saying, getting back to functioning, is that sometimes while you're working with people through that process, it actually can be really, really fulfilling to, get them on the right regimen of medications, refer them to rehab, kind of get to the root of whatever is impacting their functioning, and see them reuniting with their families, getting their job back, going from being very, oddly related and confused to thinking a little more clearly and saying, oh my gosh, I can't believe this happened. I got to do this. I got to do that. Thank you. So yeah.
Getting them back on track.
Exactly.
On their road to normalcy.
Yeah, that feeling is very, very powerful.
I bet.
Yeah.
I bet. Okay. So I'm going to ask you one last question. What kind of movies do you like?
It varies.
Or do you have a favorite movie?
What is my favorite movie? The fact I have to think would imply that I don't have one.
That's okay. The reason I'm asking is because when I first started my very first class, we were talking about movies, and someone said, you like movies that are like one of my favorite movies, and of course now I can't think of it either. The guy that had schizophrenia. He went to Harvard and developed schizophrenia, and then he ended up winning a Nobel Prize for something in medicine, or what is that? A Beautiful Mind.
I feel like a bad psychiatrist because folks reference that movie all the time.
Oh my gosh, you've got to see it.
I know, I gotta.
It was excellent. It was done by Opie was his name, as he played on the other show. What is his name? Do you remember his name? Opie?
I don't, but I remember him on Andy Griffin.
Yeah, he played Opie on Andy Griffin. I can't think of his name. I'll maybe put that. You guys don't know. He does everything he does is excellent. I mean, absolutely excellent. So if you haven't seen it, you should. But okay, so going back to you, can you think of any? What type of genre do you like?
You know, I kind of like extremes. So comedy makes me very happy.
Okay.
When I'm not working, and I prefer to laugh or be
Right.
really entertained one way or another.
Release.
Yeah, it's either that or action. I don't think I watch a whole lot of psychological thrillers, but I
Okay.
do like action or crime movies and shows
Okay.
where the character has a lot going on internally.
Okay.
I'm a little more into Netflix shows, so if you don't mind me like pivoting there.
No, fine.
I really enjoyed watching Peaky Blinders.
Haven't seen that.
Yeah, so
I'll
it's
add that to my list. But go ahead.
yeah, it centers like kind of an old school razor gang in Britain, and it's a bunch of they're Romani people, so kind of a minority within Britain at the time.
Okay.
But basically, all the men there, had to fight in a very violent war, came back, and you have a lot of former soldiers carrying all sorts of trauma who are now kind of
Okay.
coming back and rising to prominence as this gang.
Okay. Gang.
Yep, and all of them are the whole family is just a minefield of various things going on. They were traumatized before the war, traumatized during the war. Some are very depressed. You could argue at some point there's a character who has a psychotic break that's very, very powerful to watch.
Okay.
Ozark is another one I really
I haven't
liked.
seen that either.
That one's really, really good.
Okay.
It has, I think his name is I think it's Jason Bateman. He usually does comedy, but it was an unusually serious role for him,
Okay.
and he does serious really, really well. But it's basically this kind of normal American family who ends up, they have a father who's very successful because he's secretly working with the cartel. He's a finance guy.
Okay.
Things get dicey, as one might imagine, in a drama about the cartel. And he ends up basically, having to maneuver between all these very powerful people. He moves to the Ozarks.
Okay.
Because it's a place where he can launder money very effectively.
Oh,
So
okay.
he's kind of between like the government, who's getting wind of him and wants to stop his laundering / recruit him, dealing with the cartel, who already is not very pleased with him, and they have their own transitions of power. And then there's the local crime lords in Ozark themselves, and he's got a failing marriage. The kids are being raised in a crime family.
It
It's a
sounds
lot.
like my kind of movie because there's a lot going on.
It is, but they actually have, and not to spoil it
You're
for
a little
you,
bit
but
off camera.
oh, sorry, and
It's
not to
okay.
spoil it for you, but there's a character who will eventually have a manic episode.
Oh, okay.
And I think, having seen some manic episodes and seeing the response he got, it's very striking to see. I think it's really, really hard to play somebody going
Okay.
through that experience because it's very emotionally charged and easy to do wrong. But I thought he captured it very, very
Okay.
beautifully.
That was my next question.
Yeah.
Okay. Well, we're going to end here unless you have anything you want to add.
No, thank you for talking with me.
Oh my gosh, this was the best. This is the best. I say we are tribe members because you can't can't have this kind of discussion with just anybody because it's not their interest. But to speak to a tribe member who has gone to the top, I'm so happy for you.
You're very
I'm
kind.
so happy for you. So excited. So anyway, thank you to all those cozy quote people out there. Got a quote over here. I'm going to do another video in the future. If you're watching this video, please leave a comment in the section. Please suggest it to somebody else so they can subscribe. I'm trying to get to 1,000 subscribers so I can go live because Chris and I sat here for about 10 minutes because I couldn't figure out how to videotape on my computer. So we're using my phone, which is why we're so cozy. But when you make cozy quotes, you get cozy. Anyway, you guys, thanks again. Hope to hear from you soon. And again, please subscribe and leave a comment in the section at the bottom. Thanks.
Thank you.
Bye.